Good morning.
Good morning.
Welcome to Plastic Surgery 90210. My name is Ariel.
And I'm Dr. Katzen.
And today we're going to be talking about how to anti-age your hands. We always talk about, our aging faces, our aging bodies. We don't talk that much about hands, and they really do kind of give away your age,
Yep.
And before we get started on the anti-aging the hands, what do we have here?
We have a matcha latte with oat milk. So good.
Gosh. So good.
Yeah.
Cheers.
Cheers.
Thank you to Fairgrounds for sponsoring our podcast again. It's so creamy.
The best way to
delicious.
start out a morning.
Yeah, seriously.
And Fairgrounds is about a block away. We try to go there every morning, and they have amazing coffee. And I haven't had their sandwiches, but...
Oh my god, their sandwiches are so good. Okay, if you go there, you have to get the spicy Dawn. So bomb.
And if you come to our office, we have coupons for...
Yeah, we'll give you a little coupon. Yeah. They use ceremonial grade matcha, which is the finest matcha from Japan. So, and look at this color. It's beautifully green. This color's perfect. All right, so back to hands.
So you can see young hands, you can see old hands, young hands, old hands. And what happens as we age, the skin thins out, the skin becomes less elastic, and you lose some of the fat between the tendons. These little things that you see here, these are the extensor tendons. So when the muscles in the forearm contract, the finger goes up. So at repose like that, the muscle is relaxed, and as the muscle contracts like a rubber band, it brings that up. So these are the tendons that you see in there. So it's pretty complicated anatomy. But as we age, the fat thins out over the hands. The skin also thins out, and the elasticity of the skin doesn't bounce back as much.
Okay, so can you talk about what you do to make the hands look younger?
Yeah, so what we want to do is we want to camouflage the tendons, okay? So one of the ways we camouflage it is we inject fat. Yeah, so a lot of people have a little bit of fat to throw around, no pun intended. So when we do liposuction, I always ask patients, is there anything you want to do with the fat? Maybe we're transferring the fat to the buttock, maybe we're transferring the fat to the breast or the face, but we can also do the hands. So instead of throwing away that precious fat after liposuction, we try to recycle it.
And this procedure is also pretty minimally invasive, right?
Yeah, pretty minimally invasive. You can do it under local. You can do it under general anesthesia too. But what we do is we take the fat out from one area. Typically it's the tummy, love handles, maybe inner thighs, maybe back, etc. And we make a little teeny tiny, like a needle incision between the web spaces of your fingers. Right between the fingers there. Boom, boom, boom. You barely even feel that. We make one little right there. And then we lay the fat between the tendons to camouflage the tendons.
Yeah, and when your hands, in general, when you look at the hands, you cannot see those incisions at all.
Yeah, you can't see them.
Yeah.
They heal up beautifully.
Is this one of your favorite procedures to do?
Yeah, it's very dramatic. It's very quick, and we see very dramatic results. And usually the fat in that area, one of the problems is it's a pretty mobile area. You're always opening and closing your hands, is that the tendons are sliding. So unlike maybe other areas like the buttock or the breast where it's not moving around that much as the hands, the fat sometimes gets eaten up a little bit quicker on the hands. But typically fat transfer to the hands usually lasts between maybe about 5 to 7 years the way we do it.
Okay, great. That's not bad.
No.
Yeah, that's a long time. Are you able to inject filler into the hands?
You can do filler, but the filler after a while gets a little expensive. And then every 18 months to 2 years, you have to redo it because the filler dissolves.
And it dissolves way faster than the fat.
Correct.
Yeah.
Correct.
Okay. When you fat transfer to the hands, does it help with the illusion of the thinning skin?
So it doesn't make the skin thicker. It basically just puffs up the dorsum of the hand. Not sort of big and puffy like a muffin top. So it helps to camouflage the veins. So they're veins that bring blood back from the fingertips to your heart, and those veins can be camouflaged with the fat transfer.
Is one session usually enough, or do patients tend to need touch-ups?
Usually one session is enough. You don't need a lot of fat injected into the hands to get a successful outcome. So usually one surgery is enough for the hands.
How long does this procedure usually take?
The injections for the fat on the hands usually takes about an hour and a half for both hands. But you got to remember it's a two-part thing. You can't inject the fat if you haven't harvested the fat. So we're doing lipo first. So when we do traditional lipo, fat transfer to the hands, it's going to take maybe about 2 hours total. If it's just doing lipo for fat transfer to the hands, maybe about 2 hours. But if we're doing 360 lipo or lipo in the inner thighs and the arms and the back and the neck, things like that, where we're doing a lot of lipo. And then, yeah, oh, by the way, doing fat transfer, that procedure is going to take longer because we're doing more lipo.
So if someone comes in just for fat transfer of the hands,
yep, maybe about 2 hours.
2 hours, you think?
Maybe about 2 hours.
Wow,
and
that's
again,
pretty quick.
And again, that can be done under local, IV sedation, or general anesthesia, sort of depending what you want to do.
Got it. And do you have more women or men who seek this procedure?
About 50-50 in my practice. Yeah, so it really depends on the patients. Usually it's an older demographic because that kind of makes sense because the skin is thinning out and the tendons are showing more.
If someone is already coming in for lipo and they were maybe in their 30s, would you recommend they just get this as a preventative thing?
Yeah, again, anytime you're taking out fat and throwing it away, might as well recycle it. Instead of throwing it away, use it.
Yeah.
Okay, so it is a good preventative surgery. We don't make your hands look too young. We make them just right. So I think it's a good preventative measure.
Got it. Okay.
Sort of like maybe getting a facelift at a younger age, sort of preventing the need for more of an aggressive facelift later on.
Do hands continue to age naturally after the procedure, or does it slow the aging process down?
It slows the aging process down.
Okay.
So we put fat in there again to camouflage the tendons, but still over time, that fat that's even injected will slowly dissolve away.
What's the downtime like for fat transfer to the hands?
Pretty minimal. Maybe it's going to be about 3 to 4 days. Pretty quick.
Oh, okay.
Yeah.
And let's say you played like an instrument like a violin or a guitar, how long do you think you should hold off on that?
I'd probably like you to relax for about 2 weeks on, fine dexterity movements like that. But you can be, on a keyboard, usually typing, laptop, stuff like that, usually within about 3 to 4 days.
Do you feel like overusing your hands could jeopardize the fat survival?
A little bit. So again, those first couple of days, usually takes about 48 hours for the blood supply to sort of reestablish for the fat transfer. So usually in those 48 hours, I don't want you doing too much.
What can you combine this procedure with?
A lot of other things. Again, the procedure doesn't take too long, so you can combine it with tummy tucks and body lifts.
You combined this the other day.
Yeah, so we combine this with liposuction, in this case, Vaser high-def liposuction, the upper arms. She looks amazing, okay?
Yeah.
She's got biceps and triceps, and she works out a lot, but she wanted more muscle definition in the upper arm. So you can couple this fat transfer technique with pretty much any liposuction that you're doing or any other incisional surgeries. Tummy tuck, breast dogs, breast lift, facelifts, things like that.
On average, how many cc's do you need for your hands?
Really depends on the patient, but typically it's going to be maybe in the order of 30 to 50 cc's per hand, something like that. So you don't need too much.
Oh, nice. Does fat transfer to the hand affect grip strength, flexibility, or function?
No. These are cosmetic, and the fat is loose, and we're filling in an area of previous indentation, so it doesn't inhibit form or function.
And I guess we should extra trust you because you used to specialize in hand surgery.
Yeah, so I've done tens of thousands of hand cases. So I love doing hand surgery. So I feel very comfortable doing these fat transfer procedures.
Is there anything that is really risky about the fat transfer to the hands?
Yeah, you don't want to overfill it. You definitely don't want to get into the muscle bellies. There are small little muscles within the hand. You don't want to get into any of the veins in that area. So it does require a little bit of technical dexterity, but it's a pretty straightforward procedure.
Do a lot of plastic surgeons offer it?
A lot of plastic surgeons don't offer it. I think they should offer it. Again, when you're doing things like facelifts, you're focused on the face, but you could also think about doing other things at the same time as the facelift, like fat transfer.
I'm sure they will now.
I hope so.
If someone's on the fence about getting this procedure, what would you say to them?
Don't hang out on the fence. It's a dangerous place to be. So if you're on the fence, if you're doing liposuction, if you're getting the fat out, you might as well do it. It doesn't really hurt. The downtime is minimal. The risks versus benefits, minimal risk to the procedure.
And where can listeners go to see before and after photos and book a consult with you?
So on our website, we got a lot of before and after pictures, a lot of fat transfer to the hands. We also have YouTube videos on the same procedure, so you can see exactly how I do it.
Okay. And to book a consultation with Dr. Katzen, you can visit our website, or you could follow us on Instagram and DM us there at Dr. Katzen MD. You could give our office a call at
310-859-7770.
And we're actually running a summer special right now where you get free neck liposuction when you book a skin removal procedure.
Okay.
Almost every skin removal procedure, like tummy tuck, body lift, just not PBL, because you have to recover on your
Correct.
tummy.
Yeah, PBL is a posterior buttock lift where the incision goes across your back. So for that, you're on your tummy facing down. And when you're facing down, your neck's going to be twisted. So we don't want your neck twisted if we do neck liposuction. But we can do neck lipo when we're doing things like a tummy tuck or a body lift or a thigh lift or an arm lift or breast lift, torsoplasty, breast augmentation, facelift, things like that.
Yeah, so it's a great special. We're also offering free consultations with this special. It's only lasting till June 15th, so you have to make sure you get in for your
quick.
consult before that. Yeah.
Quick.
Yeah, we got to move fast here. Summer's almost over.
I know. It's crazy. Half the year is gone.
I know.
It's almost
Oh my
Halloween.
God. Speaking of that.
I got a great present from one of my wonderful patients. Check this out.
I've been ready for Halloween since last Halloween. That is you.
That's
that is
totally me.
You.
So we got about 4 months. Are you ready?
I'm right. We still have the Halloween stuff all right there.
I know. I'm ready to go.
You might as well
Should I decorate?
decorate.
I think it's a good idea.
Yeah. Okay. Well, that's really nice. That's a nice gift.
Yep.
Someone really knows you.
Yep. Absolutely.
Thank you, Fairgrounds, for our amazing matchas.
Thank you.
Thanks
Yummy.
for watching. Please subscribe, and we'll see you next time.
Cheers.